हेलो बेटा, आपको स्लाइड आ रही है दोबारा?
जी सर, आ रही है ना सर।
Okay, we will start where we left.
Let's start.
Yeah, we start again, just 5 minutes more. Thank you. So the treatment is multimodality surgery, radiotherapy, and chemotherapy as well when needed as an adjuvant or one after the other. Now surgery, whenever you do surgery, you will be including wide excision of the growth, whatever is the area involved, with clear margins, all three directions, lengthwise, breadthwise, as well as depthwise, which is very difficult in the oral cavity. You have to remove whatever is involved and then replace or reconstruct. Like in this picture, you can see this gentleman has had his oral cavity tumor removed. He's got a lot of scars here. Something was moved from here to replace the gap, the soft tissue gap in the oral cavity, build up his lip as well as his tongue. This is known as flap plastic surgery. A flap of deltopectoral skin as well as the soft tissue was done, pediculed and taken into the oral cavity to build it up and replace the soft tissues. Similarly, if the mandible is involved, like in this growth, teeth will go, the part of the mandible will go, which is here, the specimen removed. That has been reconstructed by a prosthesis here and repaired so that his mobility and chewing ability is regained. Although not as good as what he was, but this is the best we can offer. And the cure is there. Once you remove the growth, the tumor, this is a life endangering. So his system will be slightly involved. His articulation, his mastication will be slightly affected, but he will survive. Now here you can see that both sides of the mandible were removed. Bilateral neck dissection was done, and this guy is still living. Half of his oral cavity and lower part of the face is gone with this tobacco, as the picture says. Same thing. This is a very famous picture from one of our great head and neck surgeon of the time in America, Sloan Kettering Hospital, Mr. Shaw. Look at his, both mandibles were gone, lips was reconstructed, but the guy can still drink, he can still eat and talk with his speech, and he's still alive. The same is on this picture here. Entire upper part of the maxilla was repaired, and the prosthesis nose was built up. This is a prosthetic nose, artificial eye as well. So you have to save the life for whatever is the price. You can see here, artificial dental stainless steel plate is being used to replace the arch of the mandible, so that then you can close it, heal it up as a prosthesis, and this is a post-op picture. So you need a lot of cooperation between a general surgeon, head and neck surgeon, a plastic man to take up skin, muscle, and maybe bony flaps from this part, take up under the neck, and replace the mandible as well as the skin and part of the tongue as a bulk, known as packed myocutaneous or maybe packed osteomyocutaneous. Bone as well as muscle as well as skin tissue go inside, replace, cover up the defect, and come out. So you need a teamwork. So in summary, talking about disease of oral cavity, we'll talk that the ulcers are very common. They have a common presence. Everybody, all of our doctors will have to treat one of them. Aphthous are very common, so are herpetic, traumatic, and autoimmune, and they have to be dealt. They take their time, 1 to 2 weeks. You have to treat them symptomatically and treat the cause. Pre-pregnant conditions are there. We have to take care of them and try to remove the possible causing offending agent. Avoid whatever is possible. Some of them are preventable, like spirits, smoke, panchalia. If you avoid them, there are less chances of getting all these dangerous diseases. Oral carcinoma can also be prevented by reducing pan, chalya, smoking. In the western part of the world, HPV is also one of the common one of the causes of oral cancer. That also has to be dealt and looked into in the serology. But in our part, this is not as common, except the CS cervix. Attendance of good hygiene, oral hygiene is very, very important. Early diagnosis is the best for prognostically. Early the diagnosis results are better. And teamwork of surgeons, radiotherapists, and rehabilitation is mandatory in treating this disease. Thank you. Thanks. Thanks. Yeah, just a minute. Let me take my shots, snapshots. आराम से करो, आराम से. Yeah. Am I still on? Yes. Okay, Uruj, you take a picture as you doing before, and I will also try.